El liderazgo auténtico, inclusivo, estratégico y impactante. My name is Kate Clitheroe, and my project explores the barriers and enablers of women leaders in Latin America in order to inform future leadership capacity building efforts. Research shows that leadership capacity building is a critical component of successful health programs and healthcare systems. And if you're watching this video, you're likely already supportive of the concept that strengthening the leadership skills of women has the potential to make an even more significant impact on global health.
But why Latin America? After all, Latin America has made enormous strides in improving health outcomes. Why not focus efforts elsewhere? For one, despite progress, health disparities continue to exist within countries and across the region. Further economic growth could exacerbate these disparities and add new health concerns. Second, after working in the region for over a decade and meeting so many brilliant women leaders, I couldn't help but ask myself if they too might benefit from a program like WomenLift Health. You'll see on the screen examples of the women I've worked with. All of them work tirelessly to provide care and improve the health outcomes of their communities, yet many are doing so with minimal support, mentorship, guidance, and targeted leadership training. What would happen if they were given the support they needed to make an even bigger impact? Would it be possible to prevent the region's health disparities from getting any worse? And so, with so many questions on the table, I set out to find the answers.
Before sharing more about my methods, I must admit that when I first mapped out this project, I had actually planned to dive in headfirst and build a new program for leadership capacity building in Latin America. This would have been my traditional approach. I'd gather experts in the field and we'd work together to develop and deploy the content. Yet, after leaning more into this leadership journey, I decided I would instead flex a different leadership muscle. I would approach this project more strategically, with curiosity and reflection. I'd ask more questions, conduct a bit of research, and analyze the data before jumping in.
My first step was to see what already exists. I would conduct a literature review to see what I could learn about the needs of women leaders in Latin America. Then I wanted to hear directly from women leaders. I would conduct surveys, interviews, and focus groups with key women health professionals to hear their perspectives. Finally, I would analyze what I had learned and produce a report that could be disseminated to engage others in this work. Today, I would love to share what I've learned thus far. From the literature review, I've learned that while some leadership programs do exist, countries in Latin America have fewer programs as compared to other low middle income countries. This is possibly due to language barriers, a lack of international partnerships, and, you guessed it, underfunding. This wasn't too much of a surprise, knowing that so many efforts are focused on other parts of the world. More interesting, perhaps, was what I learned from women leaders in Honduras. When asked what the barriers were to women holding leadership positions, many shared that cultural beliefs, and namely a very machismo culture, was the most significant. This strong sense of masculine pride and even a glorification of traditional masculine traits means that leaders are expected to act in a certain way. They felt these stereotypes led to a very narrow view of leadership. One respondent emphasized the point by sharing that some believe men are meant to lead, women are meant to serve. Because of this, they shared that men in leadership is just the norm. It's the way it's always been. As a result, they felt that not having many women leaders as role models made it difficult for them to visualize the alternative. On the other hand, when asked what they felt encouraged by, several referenced finally having a few role models, such as the newly appointed female minister of health. Others referenced the ability to work remotely, which enables a more flexible working environment. To push the needle, they believe it would be important to promote and share the stories of those role models who do exist, while also creating spaces for women to mentor, network, and support each other. They also talked about leveling the playing field by pushing for new policies that would encourage diverse and inclusive organizations. And finally, they asked for opportunities to educate, empower, and train women leaders. When asked for more details, it was interesting to hear that they wanted a blend of what they called traditional professional development and leadership training, paired with complementary skills such as managing stress, interpersonal relationships, work-life harmony, and promoting self-esteem. They also wanted to learn more about how to push for gender equality and enact change within the system. Finally, they asked that the program be done in a supportive environment that encouraged networking and collaboration.
While some of these findings are familiar and reflect the voices of women around the world, these initial conversations revealed several nuances that would be important to incorporate for a future leadership program in Latin America. I hope this project spurs conversation and perhaps more research so we can better understand the needs within countries and across different regions, ultimately allowing for a more strategic, inclusive approach that truly fits the needs of our colleagues in Latin America. I'm grateful for the opportunity to learn more about a passion of mine, as well as about myself as a leader. For me, leading authentically means being the bold, courageous, forward-thinking leader I am, while also taking necessary pauses to reflect and ask questions before diving in. I would like to thank WomenLift Health and their partners for their guidance and willingness to share lessons learned, as so much of this project was modeled after their work in other regions of the world. Thank you so much, and please don't hesitate to reach out and join the conversation.